Welcome back to Mid Morning. October is Audiology Awareness Month, a time to focus on hearing health. And Bluegrass Hearing Clinic is helping Kentuckians hear better every day.
Joining us now is Dr. Helena Pinheiro to talk about the importance of seeing an audiologist. Thank you so much for being here today.
Thank you for having me. So I'm an audiologist. I specialize in cochlear implants. And so basically we administer hearing tests at Bluegrass Hearing Clinic. We manage tinnitus, we fit hearing aids and cochlear implants, we manage a rehabilitation program for hearing losses, and we also advise patients on a better way to protect their hearing for the future.
What is tinnitus?
So tinnitus is basically a phenomenon of just hearing ringing in the ears or buzzing, hissing, sounds that are not actually there.
I was going to ask, so it's Audiology Awareness Month. Obviously, you guys are highlighting really important things for folks who maybe don't understand why they would want to go to an audiologist. Why do we need to have audiologists? Y'all play an important role, correct?
Yes, absolutely. So not only do you check like your blood pressure when you go to the doctor, your glucose levels, but you also need to get your hearing checked. It's a huge component, and it's recently been found to be linked to dementia. And so we definitely want to prevent that, and the best way to do that is to have your hearing checked and be fit with hearing aids.
And you specialize in cochlears. Can you tell us about those?
Yeah, so a cochlear implant is a lot different than a hearing aid. So a patient that needs a cochlear implant is going to have moderate to profound hearing loss. They are really struggling with their hearing aids. So a cochlear implant has two components. You have an internal component, which is this piece, and that is placed by an ear, nose, and throat physician. And then you have an external component, and we have two on the desk here. And those external components collect the sound or the speech, and it transmits it to that internal component, and it bypasses the outer and middle ear and allows you to hear directly by stimulating the auditory nerve.
You know, you do such an awesome job. And cochlear implants, I was sharing earlier, I've got a family member with a cochlear implant. But you know, you think about, oh, I've got a runny nose, I've got a headache, I always go get checked up on. We need to be getting our checkups on our ears as well, right?
Yes, so we recommend doing that as soon as you notice any signs that you're not hearing well. But most people usually don't get checked till they're in their older age, so around 40s, 50s. But anytime you notice that you're not hearing well, definitely go and get checked by an audiologist.
And how do your patients respond once they get that cochlear implant?
So typically it's kind of 50-50. They want to hear, but sometimes they don't expect to hear as much as they had anticipated. But for the most part, it's a really positive outcome. They're really excited. They're very motivated to hear. And so they're just exceptionally happy with their hearing.
Well, y'all, if you're turning up the volume on your TV right now, maybe it's time to go to Bluegrass. So
yes.
That phone number was on the bottom of the screen. Thank you so much for coming in today.
Thank you so much for having me.
Thank you.